for her brilliance, her courage, and her tireless work to defend the right to seek safety. We are proud to present the 2025 Physicians for Human Rights Award to Dr. Katherine McKenzie.
So I should start by saying that I am not Kate McKenzie. But I am excited and humbled to be surrounded by all of you here this evening. This audience is full of human rights defenders, those of you who argue in courts, in the media, in halls of power, and those of you who quietly but consistently support the right to health. My name is Katie Peeler, and I'm one of PHR's medical advisors. In 2002, I read Paul Farmer's book, Infections and Inequalities. In describing women with AIDS around the world, he wrote, quote, "What they share is a social position, the bottom rung of the ladder in inegalitarian societies." Farmer showed how the health of those at the margins is directly related to social and political realities frequently beyond their control. He provided evidence for these truths, often citing the trailblazing work of a group called Physicians for Human Rights. Ever since, I have lived my life around the fundamental truth that health is a human right, and I found my partner in that truth with PHR. Last week, a student asked me, "What keeps you going?" particularly when our very right to speak is being curtailed. My answer consisted of the usual taking vacation, exercising, but what I emphasized most was community. Being surrounded by others devoted to this mission, knowing what many risk in doing this work as we've seen tonight, and recognizing the unimaginable consequences others will endure if the work is not done, that keeps me going. It's the people at the heart of PHR's community who keep me going. People like tonight's Physicians for Human Rights Award winner, Dr. Kate McKenzie. Kate is an associate professor at the Yale School of Medicine, where she also leads their Center for Asylum Medicine. There, she conducts and teaches forensic evaluations of relief-seeking migrants, lending medical testimony to their asylum claims. Kate has been a medical expert with PHR for more than a decade and literally wrote the book for the field, Asylum Medicine, A Clinician's Guide. Even while grappling with the loss of her own sister, Kate made indispensable contributions to PHR's landmark research, exposing how some 95% of all deaths could have been prevented with adequate medical care in immigration detention. She both provided the medical expert analysis for this study and delivered these findings with policymakers, to policymakers in DC with the ACLU and PHR. This research has taken on renewed urgency this year with the crisis of medical neglect and horrific conditions in immigration detention facilities, leading it to be what NPR has called the deadliest year in the last 2 decades, with already 23 deaths in immigration detention since January. Hundreds of students and residents consider Kate their mentor, given her example as an active clinician, researcher, advocate, parent, and the rare authoritative voice who is also kind and approachable. Kate's work, teaching, and ability to uplift the stories of marginalized people in a way that moves others to act is exactly what PHR is about. It is therefore a true honor for me to be presenting the 2025 Physicians for Human Rights Award to my friend and colleague. Please join me in a round of applause for Dr. Kate McKenzie.
The answer is yes. That's my response to anything PHR has asked of me in the last 15 years as a medical expert in the asylum network, because PHR requests will always be necessary and important. There's no way I could have helped asylum seekers or trained future doctors or advocated to the public without the assistance of PHR. PHR is a colleague, a resource, a mentor, and a partner. I saw my first asylum seeker in 2005 when George W. Bush was president, when the U.S. asylum program was still supported. Now it is being dismantled without precedent. This is not normal. Everyone has the right to seek in other countries asylum from persecution. That's what the Universal Declaration of Human Rights says. And it's what drives me every time I examine an asylum seeker. I examine people like David. He sought safety in the United States after being tortured by government forces in the DRC. My expertise was not immigration law, but as a doctor, I could recognize and document the scars on David's body. Later, his attorney told me my findings were critical to his successful asylum claim. It's a small victory, just one man, but tell that to David, who is now a U.S. citizen. Simply put, PHR's work saves and transforms lives. I also can't forget Maria, whose scars I examined several years ago. She was granted asylum, got a green card, and has built a life in this country. But in recent months, as masked ICE agents in tactical gear roam our streets with impunity, she is terrified that her children will be taken from her as she is walking them to school. I got to know Wilfredo when I was reviewing records for the PHR report on deaths in detention. I never met him, though, because by the time I read his story, he had died. I did learn about the last days of his life, though, when he languished in detention, powerless, vulnerable, and sick. And then he died from a treatable illness. The number of immigrants in detention is exploding. I've spent time with asylum seekers in the detention center in Elizabeth, New Jersey. And I wonder, with more than just a little apprehension, if someone there might die tonight, 20 miles from this ballroom where we're sitting. We are witnessing a time of gleeful cruelty to asylum seekers, but witness it we must, and document, and share the findings so others know the full extent of the harm. PHR is a shining lodestar in the field of human rights. It is unwavering in its mission, while some of the most important societal institutions have crumbled under governmental threats. In the bleak midwinter of January 2025, as I've come to refer to it, I turned to PR staff, members for direction. We grappled with our emotions, still in shock, and then we got to work. And we planned the next project, the next report, the next evaluation, to meet this moment when human rights are under attack. Thank you for this award, which comes from an organization that stands alone in its support of human rights and the physicians who champion them. Thank you very much.